Hello and good afternoon. Welcome to the Bloomberg American Health Initiative Violence webinar. Thank you so much for joining us and taking time out of your schedule to be a part and listen to all of the great things that we have to share today. I'm Shannon Jones, the Communications and Events Manager for the Bloomberg American Health Initiative. Today's webinar will feature one of our Bloomberg fellows, Kate VanderThug with Futures Without Violence. We're also excited to have with us Daniel Webster, who's the Bloomberg Professor of American Health. In addition to Daniel, we have Cassandra Kathy, who's an assistant professor here at the Bloomberg School of Public Health. In regards to the Bloomberg American Health Initiative staff, we're happy to be joined by Faria Zaman, our fellowship officer, Shane Bryant, our partnership and engagement officer. A few housekeeping notes before we get started. This is an audio-only webinar, so please be sure to mute and disable your audio on the devices. There will also be a Q&A session at the end of this webinar where we will address any questions that you may have. So feel free at any time to type in some questions in the your chat pod, and we'll be happy to address those following the webinar. Technical support is available, so should you experience any technical issues, simply type your issue in the chat pod and tech support will definitely be able to assist you. Today's webinar will be recorded. A link will be sent out following the webinar and it will be posted on our website. We ask that you revisit the link and please share it with your colleagues. Again, thank you so much for joining us and taking time out of your schedule. We are excited to get started and dive into the content. So Shane and Faria, I will hand it over to you.
Wonderful. Thank you so much, Shannon, and for everyone who is joining us, both our team of folks who are presenting along with those of you who are logging in and learning more about the Bloomberg American Health Initiative. We are very excited to have you, and even more excited that our fellowship application is going to be coming available and going live in just hours, really. Starting tomorrow, the application will be available, and we are thrilled to start seeing applications coming in. So let's go ahead and get started. So the Bloomberg American Health Initiative, what we are seeking to do here is quite frankly improve the health of America. And we know that we only can do this through working collaboratively with organizations and individuals like yourselves who are on the ground in communities across the country. And we are excited to share with you how we do our work and in what areas we focus in. So we got started back in 2016. That was the year that the School of Public Health was celebrating its centennial. And it also happened to be when we learned that in 2015, it was the first year in many that our life expectancy here in the US had declined. So Mr. Bloomberg, who is an alum of the school, wanted to provide a lasting gift that would make an impact for the health of our country. So the thought leaders here at the school and at Bloomberg Philanthropies got together and eventually came up with what is now the Bloomberg American Health Initiative. And we do our work through a variety of approaches and have focus area and cross-cutting themes that I'm looking forward to sharing more with you all. So I know today we're talking more about the violence focus area, but here at the initiative, we have 5 focus areas and all of our work falls within one of these areas. So we focus on addiction and overdose, adolescent health, obesity in the food system, environment, and violence. And we take a broad approach to each of these areas. So within violence, as an example, we certainly do look at gun violence, but also intimate partner violence and community-based violence. Similarly, with environment, we definitely are concerned about air quality and climate change, but also thinking about a community's built environment and how that can affect the health of that particular community. Or air quality in schools, how it affects students' learning. And so across all 5 of these areas, we want you to know that your work, regardless if it's in violence as we are discussing, or if it's a part of another initiative, we are excited that you are interested in our logging in to learn more about the initiative. As I mentioned, we have themes for our work. So our 3 cross-cutting themes here at the initiative are equity, evidence, and policy. Within equity, we are being mindful of where we currently have a presence and partnerships with communities across the country. And we need to make sure as a national initiative that we're getting the word out and finding opportunities to collaborate in communities, both urban and rural, on the coast or the Midwest. And with also in equity, we're thinking about and being mindful of using this as an opportunity to engage and bring people into the field of public health who have a variety of lived experiences. Folks who are coming from us through different career backgrounds, be it either folks who are in law enforcement or architecture, urban planning, whatever it might be. We want to engage with folks and provide them the support and skills of public health to further their work. Within evidence, we are wanting to look at data management systems and how they can collect rich data that informs policies and programs. We also want to ensure that organizations, yourselves, and folks across the country are using that data to tell their story and to advocate for their cause. In policies, we most certainly look at national, state, and local policies using that evidence and data to inform policy changes, but are also being mindful of organizational policies and thinking about how they affect the ways in which those teams and staff members within those organizations are affecting the way that they are impacting the health of the community where they exist. So real quickly, as I mentioned, Mayor Bloomberg provided a $300 million gift, and this money is being used to also support faculty, bringing in and supporting faculty here at the School of Public Health who are going to be taking innovative approaches to find ways in which to collaborate with organizations and support fellows in their work in their respective communities. We are fully funding 50 MPH degrees and up to 10 DRPH degrees annually. We're going to talk more about that in just a second, but want to always make sure folks are aware of kind of how we were able to get here. We have 3 approaches to our work. So we've talked about the 5 focus areas. We've talked about the 3 cross-cutting themes. Now, just to briefly go over the approach, the way that we do our work, if you will. So in the research realm, we fund research annually of projects that have a deliverable. So not looking to fund research to write papers, but really working with faculty to fund research and collaborations with organizations and communities across the country that will either develop a program, a policy, or a toolkit that can be transferred from one community to the next. Within practice, as I mentioned earlier, we're supporting and bringing in faculty, 25, 5 in each of the focus areas that are going to be supporting our work and creating new courses that have direct relevancy to the work that you all are doing. But I know you all are logged in today to really be hearing more about your work and your interest in the Bloomberg Fellows Program, and that's the educational realm. So I am excited to turn it over to my dear colleague, Faria, who's going to talk to you more about the Bloomberg Fellows Program.
Thank you so much, Shane. Good afternoon, everyone. So it's my pleasure to tell you about the Bloomberg Fellows Program. So the fellowship program, it's a unique type of scholarship program. It is impact-based, and it targets individuals who are working on the front lines of any of the 5 focus areas. Fellows, they will center their studies in the focus area and engage with their organizations during the course of their studies. And once their studies are complete, fellows will serve at least 1 year at their organization following graduation. And the organization joins a huge ongoing network of practice and research with the Bloomberg School of Public Health. The initiative is working to build a very dynamic and diverse network of partnerships, and we're trying to recruit a diverse range of organizations and fellows from both inside and outside the traditional public health world. For example, some fellows might come from local governments or police departments or community-based organizations, even housing authorities and school systems, just to give you a few possibilities. And the fellowship is recruiting 50 MPH fellows and 10 DRPH fellows annually. And fellows can attend either full-time or part-time. And the applicants must apply with support from their organization. I'll tell you a bit more about that later on. And after graduation, the fellows work for at least 1 year. They have a service obligation with their organization. And from this slide, you can see that our organizations come from really diverse backgrounds, from health departments to small non-governmental or community-based organizations to health systems.
Thank you, Varia. And so now we are really pleased to share with you one of our, the actual inaugural professor of American Health, Dr. Daniel Webster, who has a great wealth of experience and knowledge in this area. And thank you, Dr. Webster, for joining us, and we'll turn it over to you.
Okay, thanks. Very happy to participate in the webinar and tell you a little bit about the work that we do here in violence prevention at the Bloomberg School of Public Health. One of my key roles is focusing on gun violence, and to that problem, I teach a course called Understanding and Preventing Violence. That was, I believe, the first course in the School of Public Health to address the problem of violence. We're beginning to take some of those educational opportunities online. My work is very similar, frankly, to the structure of the Bloomberg American Health Initiative, in that we focus on those pillars of research evidence, equity, and policy focus, and apply them again to the problem of violence. We study the impact of state gun laws. We work very closely with local officials and community members in Baltimore, looking at a broad range of approaches to addressing urban gun violence. We've also focused a great deal on the problem of suicide with guns, which actually kills more in the United States than gun-related homicides. We have a diverse set of faculty members focusing on all forms of violence, domestic violence, community violence, and suicide as well. So it's a great program and a great opportunity. I've really enjoyed connecting with the Bloomberg Fellows and really beginning to understand what they're working on in their communities and look for opportunities that that our faculty can connect with them. I think I'll stop there and do a handoff to my colleague, Dr. Cassandra Kathy, who is the Deputy Director of the Johns Hopkins Center for Gun Policy and Research and a close collaborator of mine.
Thanks, Daniel, and great overview of many of the projects that we're working on. I'm going to speak a little bit more specifically about some of the policies and different elements of research that we're focused on. So Daniel mentioned a number of policies that we're looking at. We have done a lot of research looking at handgun purchaser licensing, which you may have heard coming up more frequently in the Democratic debates. And we've built a large body of evidence showing the effectiveness of these policies at reducing homicide and suicide, but also reducing sources of guns for an underground market. We've also recently started expanding and exploring the impacts of concealed carry, sort of how civilians are allowed to obtain concealed carry licenses, including the most extreme versions where states are removing any barriers to civilians carrying guns in public, and looking at a range of outcomes, including again, homicide and suicide, but also police interactions with civilians and police-involved shootings. I had mentioned the underground gun market. So in addition to looking at policies, we also look at sort of how guns move through places like Baltimore, looking at how folks access firearms and trying to do research that challenges what you may hear in the media, that criminals don't follow gun laws, they get guns anyway. And we've done some great research, in my opinion, looking at folks in Baltimore's underground gun market. And even in times of really high violence, a large number of folks who wanted to get firearms weren't able to do so. And beyond sort of the policy and underground market areas, another really important piece of work that I'm focused on is safe gun storage. So in addition to thinking about how gun owners store their guns, working with some folks at the Johns Hopkins Hospital to think about how we can get physicians and other providers, primary care providers, better equipped to talk to their patients about guns, thinking about equipping them to understand the basics of safe storage and providing patients with a range of options as they would with many other health issues that they might counsel their patients on. So those are some of the types of work that I'm doing along with Daniel and other colleagues at our center, and just really excited that you all are interested in the fellowship and look forward to answering any questions.
Thank you both, Dr. Webster and Dr. Kathy, for sharing that. And again, folks, we have the chat function that we will be addressing any of your questions, and no need to wait. Go ahead and you can add questions in there as they come to you. And at the end of the presentation, we'll start going through them. So again, you'll activate your chat function and you can start adding questions into there, and we will start working through those at the end of our presentation. So as you can see on your screen now, here are a number of the fellows in the initiative who are part of the violence focus area. And you can see that, first of all, they're located all over the country in all types of organizations. So Josh in Minneapolis at the health department. We have Amanda who just graduated. Congratulations to Amanda, who is in Alaska at an organization that supports individuals who are victims of domestic violence, a community-based grassroots organization in a rural community in Alaska. We have Christopher, who is with the Fort Lauderdale Police Department, and Paul, who works in the legal system supporting children who are they themselves victims of violence. And so, and then others who are also a part of the initiative. We have many more, and you can see their profiles online, and are excited that they are all part of our network. And we actually are incredibly pleased and thankful to have one of our fellows, Kate, on the line with us today. And Kate will tell you more about her work as it relates to the initiative and her passion and years of experience and things that she's gotten out of the fellowship. So Kate, thank you so much for joining us, and we'll turn it over to you.
Hi, thanks so much. Hi, everyone. This is Kate VanderThug. I use she, her, they, them pronouns, and I work at an organization called Futures Without Violence that's based in San Francisco, but is a national organization with offices in DC and Boston as well. My background is really in domestic and sexual violence survivor advocacy at, a hotline or in a shelter, or working with young people around healthy relationships. And a few years ago, I was kind of really just, working within advocacy services and systems where I'd be, working to get my clients a protection order or get them into shelter, and really thinking about how these very important, so crucial services are in a lot of ways a band-aid to intimate forms of violence. It's supporting an individual survivor through a really difficult time in their life and helping them achieve safety and wellness. But ended up being very hard. Of course, as many of some of you probably know on the phone how difficult that can be, and just kind of thinking about what are some larger systemic ways that we can prevent intimate violence from ever happening in the first place, and larger systemic ways of healing both survivors and communities and people who cause harm. So that's kind of what brought me to my work here at Futures Without Violence, where I work on our health team. We focus on kind of the intersections of health and intimate violence, thinking about how health systems can really be a catalyst in communities to address intimate forms of violence. They can be, supporting survivors on an individual level. They can be offering opportunities for prevention. And at the same time, the anti-violence movement and advocates and folks working in anti-violence spaces, how they can also be thinking about the health and wellness of survivors and communities really as important as quote unquote safety. So that's kind of the framing that brought me into my really strong desire to get a background and a firm base and a public health approach to addressing violence, which is what brought me to Hopkins and the Bloomberg Fellowship. It's just really opened my world in being able to really think about how violence is indeed a public health problem. It is something that is hurting the health of individuals and families and communities, and it isn't something, it doesn't have to be that way. There are systemic ways that we can address violence and prevent it that are not necessarily so individual. So being involved in this program has really allowed me to connect with other fellows and de-silo, what are some of the root structural causes for all of these different focus areas that lead to poor nutrition, that lead to inequitable food systems and food access, that lead to violence, that lead to, risks to adolescents' health. It's really, I've been able to be exposed to the ways that these things are all at the core, coming from the same systemic problems through the history of our country, and the way that communities are supported and not within our country right now. So I think that's just a really great framing for public health, that it just brings it to the table to address violence in a different and so vital way. Kind of some of the other benefits, in addition to being able to connect with some really amazing folks working on these cross-cutting issues, I've really just so valued being able to be connected to folks, in the food justice movement and who are working on their built environment in their communities. It's just, I've learned so much and met some really wonderful, amazing people who I hope to be connected to forever, and for us to really be de-siloing together to address these health issues. In addition to that, I think, my background is very, social service, social justice oriented with not a lot of hard science skills. And I never really would have considered myself someone who could do well in a classroom, thinking about biology and data analyzing and all of these different things, stats, it sounded very intimidating to me, but it was so awesome to be in that, in those classes. And, not only could I do it and do it well, but it was so applicable to my work, being able to literally just read a study and understand what that meant and how it mattered to, the doctors that I train on how to address domestic violence, how to be able to communicate information from research and what good research can actually look like, particularly what good research around violence looks like. So that has been just so valuable, and a huge, a benefit that I'll, use for the rest of my career and probably will open doors for me in ways that I don't even know yet. And kind of in terms of the ways I've been able to implement and apply new skills, right, with kind of in real time at my organization. Just really bringing that public health frame. I think, Johns Hopkins' motto for the public health program is saving lives a million at a time. So really thinking about what does that mean for violence prevention, has been a really important reframe. And of course, all of the hard science skills, and quite honestly, just the access to literature that we can use so quickly in our work. So that's been really valuable as well. And I think that's kind of the end of what I had to share today, but I did want to just share my email. So I just shared that in the chat. If any of you are thinking of, applying, and I just highly encourage you to reach out if you have any questions at all. I can talk about my experience in the program. I'm a little more than 2 years in. I'm hoping to be wrapping up in the next year. And, have taken a very broad array of classes, which has been really wonderful, and, gotten to connect with a lot of different people throughout the school and the faculty, which has also been very valuable. So I just encourage you all to email me if you have any questions. I think that's it for me.
Kate, thank you so much. And thank you for sharing your email for folks. If you're interested in online and are looking to connect and hear what it's like to be a fellow, I strongly suggest taking advantage of connecting with Kate and hearing more about her experience. So thank you all for that presentation. And again, the chat function is open, so go ahead and add some questions in there. And if it's a question particularly for any of the presenters, we will make sure that they have an opportunity to respond. So continuing on, and I promise we don't have too much more left, so get those questions going. But just to share with you some examples of courses that we offer here and the through the violence focus area, and apologies there for the typo. It says obesity and the food system, but these particular classes are within the violence focus area. You can see a number of different courses: suicides as a public health problem, childhood victimization and public health perspective, public health in the law, and many others are all examples of courses that folks who are coming to us as a fellow in the violence focus area will be taking and have the opportunity to get more experience and exposure to. So we're excited about those, and I'm sure many more will be coming online and available in the years ahead. So Faria, you want to talk about the formats of the program?
Yes, I do. And as I mentioned, the fellowship is open to both full-time and part-time applicants. The full-time format is 11 months. That is done right here in Baltimore. And they consist of 5 8-week terms over the course of an academic year that starts in early June and goes through about mid-May. And applicants can apply to this track. And we also accept applications for the part-time format. And the part-time format is almost entirely online, except for the first 2 weeks in June, when students come here to Baltimore. They attend the MPH orientation, the fellowship orientation, and they also take a course during that 2-week period in early June. And the rest of the program is pretty much online. And it takes about 2 to 3 years. Some people can complete it in about 2.5 years, taking 1 to 3 courses per term. And most of our fellows are part-time, and we have a few fellows that are doing the program on a full-time basis.
So beyond the courses that you would be taking as a fellow, we also have additional support and resources that we provide to your employer, who we call collaborating organizations. An example of one of those is the Applied Experience Award. This is this particular award is provided to fellows and their collaborating organizations on particular projects that allow the fellow to practice the skills that they're learning in the classroom. It's a $3,500 award that we've given out over the years, and we've done data assessment projects. We have done educational videos, PSAs, if you will. assessment projects of programs through collaborating organizations. And then the great thing about the Applied Experience Award is you develop those in partnership with your supervisor and team at your organization, and the impact and the deliverable will go right back into your work. Just had a great conversation with one of our partners out of Pittsburgh, and through the Applied Experience Award, they were able to develop a Train the Trainer program for a Hep C awareness campaign. And it was so successful that they've had other organizations in the Pittsburgh metro area reach out and want to work with them. So the Applied Experience Award is it's a nice opportunity to take one of those ideas that you have on your wish list and put it into action. Other ways that we support organization is through requests. They can reach directly out to us to either connect to some of our great faculty or other organizations across the country. They might have a specific issue or research question that they in their community are looking at and would like some guidance around. Data is always, data analysis, data management, using the data to tell the story is always some of the requests that we get from our great partners and many, many others. So as we've mentioned throughout the presentation, there's a great number of courses that we're developing that are applicable to the work of folks who are on the ground like yourselves. And we continue to develop new courses in partnership with the faculty here at the Bloomberg School of Public Health. We also support a series of seminars, and the seminars are required for the fellows to participate in. And you can see we do advocacy, performance management, communication, and others. But the great thing about the seminars is we host them here in Baltimore and we simulcast them throughout the country to all of the organizations that are part of the network. And that learning is being shared with your team members and colleagues back at your home site. And we greatly value the opportunity in any way to work with and continue to find ways to engage with not just you as a fellow, but the entire organization. So we have the next one is how to apply. So I know that you all are really excited about that, and I'll ask Faria to let you know the details.
Well, I am very excited to tell you all that tomorrow, August 1st, our applications are going live. And so starting tomorrow, you will be able to access the fellowship application forms and you can begin applying. So let me talk a little bit about how to apply. So you would apply to both the MPH program and the fellowship program at the same time. Now for the MPH program, you should review the admissions requirements in the MPH website. They have an admissions tab, and if you click on that, it'll tell you the admissions requirements and instructions. Basically, you have to complete and submit the School of Public Health Application Services website. That's called SOPHIS. That's the name of the Bloomberg School's application processing system. And so all of your admissions materials, your letters of recommendations, your transcripts, everything you have to submit through SOPHIS. And once you click apply on the MPH website, it's going to take you to the SOPHIS website, and then you will have very explicit instructions on how and what to submit. So that's one part. The other part is you apply to the fellowship, and as I mentioned, tomorrow our applications will go live on our website, and we have two fellowship application forms. One is the student application, and the other is the collaborating organization application form. And both forms have 3 to 4 essay questions for you to complete. You just download the forms right there on our website. You complete them, and then you also submit them right on our website. So it's really easy. If you have questions about this or any questions at all, my email is on the last slide, so feel free to reach out to me, and I'm happy to speak with you over the phone, help you through the process.
All right, and we are, very excited that the application is becoming available. And if you could see our our faces when we talk about it. We did a little dance even for y'all, even though you couldn't see us. But we are really excited the application is available. And Faria has another thing to even add about that.
Yes, I can't stop smiling. You should see us all. I wanted to add that the fellowship program has 2 application deadlines. So the early deadline is November 1st. And the final deadline is December 1st. And we always encourage people to submit earlier rather than later. If you can submit everything by the November 1st deadline, that's great. And in case SOFIS misses something you submitted, you're missing a transcript or something, you still have time to get that in. Whereas if you wait until December 1st and you find out you're missing something, there's no time. So please apply early.
Awesome. Thank you so much, Faria. And folks, we are getting to the end, so looking forward to the questions. I see that they are starting to come in and looking forward to answering them. A few really quick key takeaways for you all. The work that we're doing here at the initiative is impact-based. And we know that we are at a critical time, and we can't wait 5 years to look and figure out what we're gonna do about the work that you all are doing in your communities. So all the things that we do, research, practice, education, whatever it might be, we're always looking to ensure that there is an impact being made in collaboration with the communities and organizations we're working with. A very critical component to the work here at the initiative is training and providing support for the future leaders of public health, and giving them the tools to improve the health of their communities. And we're talking about you, the ones that are on this webinar. We want you to apply, and we want to support and work with you to be able to further your work in your respective communities. And finally, the Bloomberg Fellows Program plays an incredibly vital role in working for that change. We know that you all have a diversity of experiences and work with a variety of organizations, and we believe that collaborating and working together is how we're going to start to change in the trajectory of the health of our country. So that's the key takeaways that we're hoping that you walk away with today. We also hope that you'll stay connected, visit our website. That's where you're gonna find the wonderful application. Follow us on Twitter for a lot of rich information and dialogues and opportunities to connect. We have our newsletter that goes out every Friday. It is a great opportunity to kind of follow the trends in these 5 focus areas and hear some of the work that's being done here and across the country. The American Health Podcast is a way that you can hear directly from folks who are doing the work, regardless of where they're located. We go out and we like to capture those stories. And finally, our YouTube channel has some great videos and resources for you all to check out and might even be able to use at your organization. We want you to stay connected with us. Our contact information is on the screen. If you have any questions that we're not able to get to or address today, please don't hesitate reaching out. Kate shared her email address in the chat function, so also use that as a resource as you're considering applying for the fellowship. And any questions that you might have, please do reach out if we don't get to them today. But we have some time, and let's go ahead and jump into some of the questions. So the first question is a really great question. Thank you, Laura, for posing this for us. It states, it seems like many of the violence fellows are focusing their work in one particular form of violence, be it either domestic, gun violence, suicide, and in her current role, she has responsibilities working to prevent and address suicide and sexual violence. And she has personal interest also in reducing gun violence. Now, would it be possible, Faria, for a future fellow to work across these particular topics within the violence track? So maybe, Faria, if you want to get started, and then with our faculty who are on, if you have any also anything you would like to add, it would be great to hear from you. So Faria, do you want to?
Yes, thank you, Laura. That is a great question. And the answer is yes, absolutely. It is possible for a fellow to work across the topics that you mentioned within the violence track. And I also want to let you know that one of our new fellows that started just last month in our 4th cohort of fellows, one of them is working on suicide prevention. So we actually do have someone who is working in the same area within the violence track as you are, but it's absolutely possible.
Yeah, this is Daniel Webster. Good question. And just to echo Faria, absolutely. We understand and appreciate the connections between the various forms of violence. Actually, I think we can provide a link to a special issue of the journal Public Health Reports that is devoted to the initiative that includes a specific article on our approach and thinking about violence. And in that article, you'll see that we underscore and recognize the common connections between different forms of violence and also potential connections between the potential solutions to those forms of violence. So we definitely appreciate all of those connections. And many of us on the faculty certainly work across those different forms of violence.
Great, thank you. And then, Cass, did you have anything that you would like to add?
No, I think Daniel covered it.
Yeah, thank you. And we can certainly share with you the link to the supplement, and it does share lots of really great resources and a deeper dive into the work and our goals and why we selected them. So thank you for that suggestion, Dr. Webster.
And this is Kate. Can I just
absolutely
piggyback off of Daniel? Yeah. So I actually think that this is an excellent program for that. I found it very easy to connect with different faculty and thinking about how my work really spans across addressing different forms of violence. And it's actually been able to expose me to, like, I think they mentioned, a couple of the other fellows in the cohort after me who are working in different areas of violence prevention, and just really how a lot of our work is actually at the core very similar. And I also encourage you all to think, not only what are you and your organization and your community getting out of this program, but how is the field of public health and Johns Hopkins itself getting so much from you all and your perspectives and your, work and organizing that you have done. Public health is inherently, while a varied history has, today, and how I see it and believe it is a social justice field and pursuit. And I think that's how a lot of us in the fellowship program are approaching this. And so I really encourage folks who are interested in the cross-cutting and de-siloing between different forms of violence and these different focus areas to apply and, share your expertise with the rest of us, because I think that's as equally as valuable. It's, it goes both ways. And I guess I'll just stop there for now.
Yeah, Kate,
great point.
Absolutely wonderful point. And Kate, thank you so much for adding that and even bringing to light the hope that we are leading and being mindful of social justice as it relates to the effects of health in these communities, and particularly in the violence focus area. Another question we have here, Faria, can you do the full-time program online?
So the full-time program is on campus. And so full-time students have to take all of the courses right here between June and May in the East Baltimore campus. Now, part-time students, as I mentioned, they can do almost the entire program online with the exception of the 2 weeks. So to answer your question, the full-time program is in person on campus.
Yeah, thank you. Great question. Is the application system, Faria, the same for the DRPH fellows applying through the SOFIS program?
Yes, Laura, it is. So to apply to the DRPH program, it's the same thing. You will find the fellowship application forms on our website starting tomorrow. And then when you go to the DRPH website, you will see when you hit the apply button, it will take you to the SOFIS website, and you would do the same thing as you would for the MPH, just submit all of your admissions materials through SOFIS.
Great. And we've had some some of the questions have come in via email. So reading one of these, respondent says they work in more than one focus area and are wondering if they can apply into multiple focus areas or if it's just the one.
So that's a great question. Applicants are required to select one focus area when they apply to the fellowship. And, you know, if you're working across different focus areas, I would say that the area that you're most committed to, that you have the most experience with and is really your focus, that's the one you should select to apply to the fellowship.
Thank you. Another question we have is who at the collaborating organization, their employer, who completes the application form?
So that's another great question. So it varies. It's really up to the applicant and the organization. Many of our fellows have their immediate supervisor complete the form and be their contact person at their organization, while other fellows may have somebody else, a more senior person within their organization. So we don't really require it to be the supervisor. It's something that can be worked out between the applicant and the organization.
Great, thank you for that question. A couple more that we got via email, and then if any more folks live here want to share any questions in the chat function, we're continuing to monitor there. I think this question would be best answered by our participants. The question is, the political climate in my community makes it hard to advocate for improved laws around guns. How will this program, or will this program, help me develop skills to further advocate around sensible gun policies? So I'll open this up to our faculty and fellow Kate, if you all have any thoughts around skills building around advocacy.
Yeah, I'll start anyway. This is Daniel Webster. Yeah, the interest is definitely shared among other students and either also among particular Bloomberg fellows within our program. So, you know, our course, the course that I teach, both the in-class one now and the one planned for the spring for online, is not advocacy course per se. It has more to do about the policies and what works. The online course will get into a little bit more of the applied aspects that will include, in some cases, advocacy elements. But there are excellent opportunities to learn key advocacy skills, and certainly to work with our faculty, both who specialize specifically in gun policy and other faculty members who focus in a more broad way about effective public health advocacy. So I think there are certainly many opportunities for someone with those set of interests. Asked you if other things you'd want to.
Yeah. So I think one of the reasons that I enjoy being on faculty at the School of Public Health here is the desire to translate our research into policy or into some kind of meaningful action. And so our work doesn't stop when we write a paper. We work with advocacy organizations, we work with policymakers, we write briefs, we create infographics, we do some of that work sort of on a daily basis. And if you're able to take a course in person, one of our colleagues, Josh Horowitz, teaches a great class on health advocacy where you learn how to speak with policymakers and sort of many of these things to advance policy or to even advance programs. But that's sort of a core element of our school, particularly our center and many of the faculty that we work with, as Daniel mentioned. So I do think that that's something you can get both formally in the classroom, but also collaborating with faculty, you can get experiences doing that kind of work and seeing sort of how we think about it.
There's actually a great example right now with a Bloomberg fellow, Jen Polykunos, who had been with a local advocacy organization in Maryland that helped to helped to get a law passed called Extreme Risk Protective Order law, sometimes referred to as red flag laws. And now she's a Bloomberg Fellow. The initiative has what we call a high impact project that is involved in helping both study and facilitate effective implementation and enforcement of extreme risk protective order laws. And the project is co-led by Dr. Shannon Frateroli and Josh Horowitz, who teaches health advocacy here. And their focus area specifically is on Maryland and the state of Washington. And so the whole experience is, Jen is in essence getting to take this to the next level of advocacy, is what happens after a law gets passed, because in many cases, that's the most important time for advocacy, to make sure that the systems respond to the policy change, because quite often they don't. So I think our program offers many opportunities because we are so engaged in frankly trying to solve this problem of gun violence.
This is Kate. I think I'll just add that's, I think, a lot of things, a similar theme that a lot of us are struggling with within our own communities. Just, doing violence prevention work can be politically difficult at times. One of the classes that I took was actually that I loved so much was a community organizing class. And I found the skills and strategies I learned in that class immediately applicable. I did a project around finding alternative solutions to kind of mental health crises that didn't rely on the police. And so that was just really interesting to kind of figure out how to best politically approach that within my community. So I definitely think that a public health approach is very useful for doing politically difficult things. So I definitely think that is something you will get out of this program.
Great, thank you so much. Another question, Faria, here about the GRE, and a question: if the GRE is the GRE required for DRPH applicants?
So Laura, the DRPH program does ask for a GRE, but I believe if you have a graduate degree, there's a possibility to waive the GRE. And I would advise you to speak directly to the DRPH program, and they will be able to give you guidance on that. And if you email me, I will be happy to connect you to the DRPH program.
Yeah, and I have one more question, and then we'll begin wrapping up. But this is another good question. I've been out of school for over 15 years and have often thought about going back. But I'm nervous about being ready to jump back into courses. What would you tell someone who has been out of school? Is there resources available, or how would we prepare to start taking classes again as a fellow?
Well, that's a great question. And many of our fellows have actually been out of school for 10, even 15 years, and also feel nervous about taking GRE and taking courses. But I want to let you know that, the fellowship program, we want to see each and every fellow succeed. And we are here to support our fellows and our organizations. So for example, if a fellow starts the MPH program and it's the first term and they're a little bit nervous about jumping into coursework, all they need to do is to let us know that they need some support. The fellowship program provides tutoring. We cover the costs of academic support. So if any of our fellows needs a tutor for EPI or for biostats or for any course at all, you need only to reach out and let us know, and we will provide that support to you. And again, that cost is covered by the fellowship. Many of our fellows ask for academic support. It's not something unusual. And as I said, we have people that have been out of school for a long time. And the other thing I suggest is to talk to the MPH program about the curriculum and the courses. And they do have some prerequisites, such as biology. and they do require applicants to have a certain amount of credits in biology and math, and if you don't have that, you can take it while you are applying to the program, and the MPH office will be able to give you more information and guidance on that as well.
Awesome. Thank you so much.
This is Kate. I can also just reflect my experience with that. I was out of school for 8 years before I applied to this program, and was super nervous because I don't come from a science background at all. And with the support of the fellowship program, I definitely took advantage of the tutors, particularly during biostats. And actually it was just really surprising and empowering for me how well I was able to do. And I was just really proud of myself for being able to buckle down, manage, working at the same time, getting what I consider to be good grades. So that was actually really surprising and great for me, that I feel like I actually am better at school now than I was, when I was 21 or 19. And the program, the fellowship program, is really there. I really felt like they were there for me with kind of anything that I needed. So that has been really great.
Thank you, Kate, again for sharing, and you are absolutely an all-star student, so we are thankful for your hard work as well. So folks, again, thank you so very much for your interest. Dr. Krafasi, Dr. Webster, Kate, Faria, and Shannon, we are all excited that you are considering applying, and I know that tomorrow, the first thing you do when you wake up, you're going to go to the website and download that application. But if you need to ask us any questions before you do that, again, our contact information is here. We're going to send out an email to everyone who registered with a link to this recording, and we'll also share a link in that email for the supplement that will be a resource for you all to read through and get to dive deeper in. So without any further ado, I hope you all enjoy the rest of your week. Thank you for tuning in, and we look forward to reviewing applications very soon. Have a great day, everyone.
Bye.